mga posibleng tanong na maaaring lumabas ngayong darating na Philippine Nursing Licensure Examination ang alay ko sa inyo for today. 15 board exam type of questions with rationalization that will cover your foundation of nursing practice. If you want to know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Gavan. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos once a week. Don't miss that. Subscribe now. Hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, nurses, let's jump into the video. Hi everybody! Welcome back nga! Isang panibagong video ang alay ko sa inyo for this week. At bago yon, kagaya ng sinabi ko sa intro, isang panibagong nursing test banking nga po ang alay ko for you. Ngayon, before I further proceed with this video, I would just like to really grab this opportunity to thank you who's watching right now because we just hit 13,000 subscribers. Hindi pa rin po talaga ako makapaniwala na 13k na tayo. Maraming salamat po. And none of that will be possible if it wasn't because of you. Isang panibagong nursing test banking video ang alay ko sa iyo dahil gusto ko sa darating na board exam ngayong darating na taon, handa ka na. Yes, you heard it right. Kagaya ng sinabi ko dun sa intro, 15 board exam type of questions with rationalization that will cover your foundation of nursing practice. Yes. Ngayon, kung hindi mo pa napapanood yung other nursing test banking videos and some other nursing educational videos that I created on my channel, I'll be putting the playlist links on the description box or simply click this icon button kapag nagpapaut yan kasi isasama ko rin sila lahat dyan. Ngayon, gusto lang rin kitang ayayahan kasi yung Facebook page natin talaga naman nag-grow na and maraming salamat po sa lahat sa inyo na patuloy na nag-share at nagla-like ng mga videos ko. Thank you so much you guys. You just make me so happy. Now, before I further proceed with this video, I would just like to let you know about the main intention why we're creating such videos like this. The main intention why we have this nursing test banking video is that for you to have the full grasp of the rationalization so that when the time comes that you'll be getting or you'll be answering the actual board exam, when you are encountering the same sets of questions, you are very much sure that that is the right answer because you know the reason behind. Hence, we're doing rationalization. Ngayon, hindi ko na patatagalin pa. Medyo mahaba itong video na to. Let me switch back to my PC and I'll see you guys in a bit. Welcome back sa ating formal discussion ng iyong Foundation of Nursing Practice, PNLE 1. Another entry natin sa ating nursing test banking. Now, let this be your nursing study guide. Yes, oo nga po. Kung hindi nyo nga po napanood yung mga other nursing test banking videos na create ko under my channel, I highly suggest that you guys check out the playlist link on the description box or whenever the icon button pops out. Anytime on this video, just click the one out because I'll be putting the playlist together with the other playlist I have on my channel. Now, you guys, the scope of this nursing test is parallel to the nursing NP1 o yung ating PNLE 1 coverage. Ano yon? Yung foundation of nursing, nursing research, professional adjustment, leadership, and management. So you can expect that on the following questions, you might want to encounter these concepts. Alright? So proceed na tayo. Let me provide you with our objectives for today's discussion. Now, I'm gonna provide and discuss board exam type of questions. And then I'm going to provide a rationalization per each board exam type of question. So we only have 2 objectives every time we do a nursing test banking video. Now, let me give you actually the instructions for today's discussion. Handa na ba kayo? Handang-handa na. Okay. Now, you'll be given 15 board exam type of questions. I will be reading the questions and the choices for you. You have 5 seconds to answer each questions. The answer is revealed instantly after each questions with rationalization. Choose the letter of the correct answer. Good luck, nurses. Now, take this exam or take this video as if you're actually taking the actual board exam, alright? Now, like I said on the intro, I want you to guys to pay attention to the rationalization and have the full grasp of the rationalization. I really made my time, took my time to create, to explain, to research on the rationalization for you guys. So I also want you to encourage you to please put your scores below, because I would like to evaluate the scores of my students. And no shame, no shame. The main intention of this video is for you to have a review of the rationalization and how to actually do your nursing test bank test taking skills. Alright? So without further ado, nurses, hingang malalim, eto na tayo. Board exam type of question number 1. An 80-year-old female client is brought to the emergency room department by her caregiver. On the nurse's assessment, the following are the manifestations of the client. Ano yon? Anorexia, cachexia, and multiple bruises. Let me change my pen. So anorexia, you have cachexia, and multiple bruises. What would be the best nursing intervention? So kung ganito yung manifestation ng isang 80-year-old female client mo, meron kang presenting signs and symptoms sa ER, anorexia, cachexia, multiple bruises. Ano yung best nursing intervention? So kapag nakakita ka ng mga ganitong tanong, lahat ng mga lahat ng mga multiple choices na to, lahat mga choices to is correct. But which is the best? Depending on the situation. So is it A, check the laboratory data for serum albumin, hematocrit, and hemoglobin? Is it B, talk to the client about the caregiver and support system? Is it C, complete a police report on elder abuse? Is it D, complete gastrointestinal and neurological assessment? Your 5 seconds starts now. Time's up, you guys. Time is up. What is the answer, nurses? The answer is letter D, complete a gastrointestinal and neurological assessment. Hold on, nag-chat si mama. Kailangan ko lang replay ng aking mujay. Okay. So the answer is letter D. Why? So here's the rationalization lesson, you guys. Assessment and more data collection are needed. The client may have gastrointestinal or neurological problems that account for the symptoms. The anorexia could result from medications, poor dentition, or indigestion, and the bruises may be attributed to ataxia, frequent falls, vertigo, or medication. Hence, the answer is letter D. Nakuha yon, nakuha. Board exam type of question number 2. The night shift nurse is making rounds. When the nurse enters a client's room, the client is on the floor next to the bed. So what is your situation? Nagra-round yung mga PM shift. Nakita yung client, nasaan? Nasaan yung client? On the floor next to the bed. Hindi ito si J-Lo, pero he's on the floor. What would be the initial? What is the first thing that you will do as a nurse? Is it A, chart that the patient fell? Is it B, call the physician? C, chart that the client was found on the floor next to the bed? Or D, fill out an incident report? Remember, you're just doing your nurse shift, your rounds as a group. All right. So what would you do if you're the nurse in this situation? Your 5 seconds starts now. Time is up, nurses. What is the answer? Very good. Letter B, call the physician. Now, this is closest to suggesting action assessment rather than paperwork, and is therefore the best of the 4. All right, so most of them are actually talks about paperwork. Chart, the patient fell. Chart, the patient was found on the floor. Fill out an incident report. Most of the 3 choices are talking about documentation, but only you are actually asked by action. My verb. Well, documenting is an action, Yani, baby, but you really wanna be critical when it comes to this one. So the answer really to this is B, call the physician. Board exam type of question number 3. The nurse on the night shift is about to administer medication to a preschooler client and notes that the child has no ID bracelet. Nako, walang pagkakakilanlan yung bata, no ID bracelet. The best way for the nurse to identify the client is to ask, paano mo daw i-identify ang isang pasyenteng walang ID band? Pasyente ang edad ay preschooler, ha? Anong gagawin mo? A, the adult visiting the child's name is? Are you gonna say that? Are you gonna ask that the child's name is? Or B, the child is your name? The child, or you're gonna ask the child, is your name? Ganon. Or C, another staff nurse to identify that this child, or D, another children in the room, what the child's name is. Kapag ayon ang sagot mo, sinasabi ko sa iyo, girl, bujurt, charing. Your 5 seconds starts now. Time's up, you guys. What is the answer? Very good, very good. Letter C, another staff nurse to identify this child. Why? The only acceptable way to identify a preschooler client is to have a parent or another staff member identify the client. In this situation, walang ID band, preschooler, C is the right answer. Nakuha yon, nakuha. Very good. Board exam type of question number 4. The nurse caring to a client has completed the assessment. Which of the following will be considered to be the most accurate charting? The most accurate charting of what? Lump felt in the right breast. So, paano mo daw i-document, nurse? Nurse ka. Paano mo i-charting yung lump felt in the right breast? What is the best way to document it? That is the question. Is it A, abnormally felt area in the right breast drainage noted? May drainage bang sinabi? Lump lang, diba? Huwag kang invento. Is it B, hard nodular mass in a right breast nipple? Mag-isip-isip ng direction, girl. Okay? Is it C, firm mass of 5 clock outer quadrant, 1 cm from right nipple? Or D, mass in the right breast, 4 centimeters by 1 centimeters? Ang galing, char. Your 5 seconds starts now. Time's up, you guys. What is your answer? Very good. It is actually letter C. Perfect. Firm mass at 5 o'clock outer quadrant, 1 cm from right nipple. Why is this the answer? Because it describes the mass in the greatest detail. Alright? Board exam type of question number 5. Nakakarami na ba kayo? So far, so good ba mga tanong? Very good. Okay. 5th question na tayo. The physician instructed the nurse that intravenous pyelogram will be done to the client. Anong situation? Meron kang intravenous pyelogram. Naku, may ikot-ikot na yung mga ulo nyo. Kalma tayo, ha? The client asks the nurse, what is the purpose of the procedure? So, kung may idea ka kung ano yung intravenous pyelogram, tatanungin mo ano yung indication niya because this question is really asking you about the purpose of the procedure, the indication of the procedure. The appropriate nursing response is to definition of terms lang to nurses ng iyong intravenous pyelogram, including the purpose or the indication. Is it A, outline the kidney vasculature? D, determine the size, shape, and placement of the kidneys? C, test renal tubular function and the patency of the urinary tract? Or D, measures renal blood flow? Your 5 seconds starts now. Time's up. What is your answer? Very good, nurses. Letter C. Perfect. Test renal tubular function and the patency of the urinary tracts. Why? Now listen, intravenous pyelogram tests both the function and the patency of the kidneys. After the intravenous injection of the radio-opaque contrast medium, the size, location, and patency of the kidneys can be observed by raw antigenogram, as well as the patency of the urethra and bladder as the kidneys function to excrete the contrast medium. Hence, the answer is letter C. Okay. Nako. Halfway through, hindi pa tayo halfway through. Mga nakaka 1/4 na tayo. How is your score, you guys? Now, before anything else, gusto ko lang magpasalamat ha. Pang 13,000 subscribers na nga tayo. Kung hindi ka pa nagsusubscribe, pang Lucky Charm, opo, ngayong taon, mag-subscribe ka na, hit mo na yung lucky. Hit mo na yung subscribe button, and then like mo na rin tong video na to kasi it really helps a lot. It really does help a lot my channel. And don't forget to share this video to your friends because sharing is caring. Wag selfish, wag ganon. Hindi tayo ganon dito, okay? Now, board exam type of question number 6 na tayo. A client visits the clinic for screening of scoliosis. The situation nurses is screening of scoliosis. The nurse should ask the client too. Kapag gagawa ka ng scoliosis screening sa isang pasyente, ano ang sasabihin mo sa pasyente mo? Base sa mga bakit ba ako nabubulol? Base sa mga choices na ito. Mind you guys, dapat mag-focus ka sa tanong na screening of scoliosis ang iyong situation. Is it A, bend all the way over and touch the toes? B, stand up straight and tall as possible? Is it C, bend over at 90-degree angle from the waist? 90-degree angle from the waist? Is it D, bend over at 45-degree angle from the waist? Nako. Oo nga, char. Okay, what is your... I'm gonna give you time to answer this one, so I will give you 5 seconds and it starts right now. Time's up, you guys. What is the answer? Very good. Bend over at 90-degree angle from the waist. Letter C. Now, why? This is recommended position for screening for scoliosis. It allows the nurse to inspect the alignment of the spine as well as to compare both shoulders and both hips. Hence, the answer is letter C. Malino yon. Board exam type of question number 7. A client with tuberculosis is admitted in the hospital for 2 weeks. When a client's family members come to visit, they would be adhering to respiratory isolation precaution when they... So, paano mo daw masasabi na ang family ng client mong may TB ay nag-a-adhere o nagko-comply sa respiratory isolation precaution ng hospital? That is the question. Is it A, wash their hands when leaving? B, put on gowns, gloves, and mask? C, avoid contact with client's roommate? Or D, keep the client's room door open? Your 5 seconds starts now. Concept ng TB, you guys. At infectious disease. Nalala ba yun? Naalala pa. What is the answer? Letter A. Very good. Wash their hands when leaving. Why? Hand washing is the best method for reducing cross-contamination. Gowns, gloves are not always required when entering a client's room. Okay? Okay. Board exam type of question number 8. An infant is brought to the emergency department and diagnosed with what? Pyloric stenosis. Familiar ba tayo sa concept ng yung pyloric stenosis? I believe nag-create na ako ng ganito sa channel ko ng discussion nito. Hindi ko lang sure. Kung hindi pa, sabihin nyo lang sa akin sa comment section. Nasa medical surgical nursing playlist yon. Panoorin mo yon. Ang dami na nating mga med-surg concepts doon. Okay, so the parents of the client asked the nurse, why does my baby continue to vomit? Yun ang tanong. Bakit patuloy na nagva-vomit o nagsusuka yung anak ko? Which of the following would be the best nursing response of the nurse? Kapag yun ang tanong sa'yo ng parent, why does my baby continue to vomit? What is your response? Knowing that the patient is diagnosed with pyloric stenosis. Is it A, your baby... baby. Is it A, your baby eats too rapidly and overfills the stomach, which causes vomiting? Is it B, your baby can't empty the formula that is in the stomach into the bowel? Is it C, the vomiting is due to the nausea and accompanies pyloric stenosis? Or D, your baby needs to be burped more thoroughly after feeding? Your 5 seconds starts now. Time's up, nurses.
What is your answer to this one? Very good. Letter B. Your baby can't empty the formula that is in the stomach into the bowel. Bakit, nurses? Listen, pyloric stenosis is an anomaly of the upper gastrointestinal tract, upper GI. The condition involves a thickening or hypertrophy of the pyloric sphincter located at the distal end of the stomach. This causes a mechanical intestinal obstruction which leads to vomiting after feeding the infant. The vomiting associated with pyloric stenosis is described as being projectile in nature. Yung natalsik na suka. This is due to the increasing amounts of formula the infant begins to consume coupled with the increasing thickening of the pyloric sphincter. Malino ba yon? Malinaw. Nakakarami na kayo? Very good. I'm so proud of you. Keep it up. Board exam time for question number 9. A 70-year-old client with suspected tuberculosis is brought to the geriatric care facilities. An intradermal tuberculosis test is scheduled to be done. Ano yon? Ano yung intradermal? Skin test to sa mga TB. Naalala pa yon? Naalala pa. Tuberculin test. The client asks the nurse what is the purpose of the test? Ano dang purpose ng tuberculin test? Ano yung indication niya? Why is it being done? Which of the following would be the best rationale for this? Tinatanong ka rationale ng tuberculin test. That is the question. Is it A, reaction of an old tuberculosis infection? Is it B, increased incidence of new cases of tuberculosis in persons over 65 years old? Or C, greater exposure to diverse healthcare workers? Or D, respiratory problems are characteristics in this population? Your 5 seconds starts now. Time's up, nurses. What is your answer? I-reveal na natin the letter B. Increased incidence of new cases of tuberculosis in persons over 65 years old. Why, nurses? Now, increased incidence of TB has been seen in general population with a high incidence reported in hospitalized elderly clients. Immunosuppression and lack of classic manifestations because of aging process are just two of the continuing factors of tuberculosis in the elderly. Hence, the answer is letter B. Nakakarami na tayo ha. Last 6 questions na for this video. Kung hindi ka pa magsasubscribe, subscribe ka na. Okay, follow mo na rin ako sa TikTok and IG, please. And don't forget to please share, like, and follow me on my Facebook page. Alright, proceed na tayo. Board exam type of question number 10. Gusto mo may promote? Okay. The nurse is making a health teaching to the parents of the client in teaching parents how to measure the area of induration in response to a PPT test. The nurse would be most accurate in advising the parents to measure. So, measurement ng iyong duration ng PPT test. Gano'n daw katagal? Both the areas, is it A, both the areas that look red and feel raised? B, the entire area that feels itchy to the child? Is it C, only the area that looks reddened? Or D, only the area that feels raised? Your 5 seconds starts now. Concept ito ng iyong induration ng iyong PPD test. Alright, what is the answer, nurses? Very good. Letter D, only the area that feels raised. Why? Parents should be taught to feel the area that is raised and measure only that. Malinaw yon? Malinaw. Board exam type of question number 11. A community health nurse is scheduled to do home visit. She visits to an elderly person living alone. Oh, kawawa naman. Which of the following observation will be a concern? So, kapag isa kang CHN, community health nurse, gagawa ka ng home visit mo, ang kliyente mo is elderly, na mag-isa sa bahay. Aling observation ka maaalarma? Alin dito, sa mga choices na to, ang magpapaalarma sa'yo? Yung talagang mawiwindang ka, parang ganon. Is it A, picture windows? Is it B, unwashed dishes in the sink? Is it C, clear and shiny floors? Or D, brightly lit rooms? Your 5 seconds starts now. Minsan may mga ganito sa tanong sa board talaga, girl. Sabi ko sa iyo, time's up, nurses. Yung parang tinetest nila yung common sense mo, pinag-iisip ka nila outside of the box. And mapapayo ko lang, you just have to use your common sense and your critical thinking because it really saves you up. Sometimes you don't have to overthink the question too much, overdo it, because you will end up with the wrong answer. Just use your common sense. The simplest word, the simplest answer is sometimes the right one. Alright? And also, don't forget to follow your instinct, that whisper. Okay? So what is the, di ba may words of wisdom pa tayo? Ang saya. What is the answer to board exam topic of question number 11? Anong sagot mo? Letter. Nako, talaga namang kudos. Love na love ko. Nakatama dito. Letter C. Clear and shiny floors. Kung hindi naman nakatama, love pa rin kita. Huwag ka mag-alala. Ito na yung rationale, ha? Para sa actual board na nakuha mo to o na-encounter mo to, ito ang sagot. C. Clear and shiny floors. Why? It is safety hazard to have shiny floors because they can cause what? Falls. Tandaan mo, falls ha, hindi waterfalls, kundi falls, yung laglag. Because ang client mo is elderly, that's one. Tapos mag-isa pa. Pag shiny ang floor ng isang bahay ng isang client ng gano'n na masyunda, risk for fall, high risk for fall. Safety. Alright? Hence, letter C is the answer. Board exam type of question number 12. After a birth, a physician cut the cord of the baby. And before the baby is given to the mother, what would be the initial nursing action of the nurse? O, nasa DR. Kinat yung cord. Tapos, bago ibigay kay baby, anong next mong gagawin as a nurse? Initial nursing action. Is it A, examine the infant for any observable abnormalities? B, confirm identification of the infant and apply bracelet to mother and infant? Is it C, instill prophylactic medication in the infant's eye? Creeds prophylaxis ata ito. Tama ba? Ano ba yung nilalagay sa mata? To avoid cross. Nakalimutan ko na. Yung ointment na nilalagay sa mata. Basta yun. Kung naalala mo, ilagay mo dyan sa baba to avoid night blindness. Kalimutan ko na. I'll research about it. Is it, do you wrap the infant in the pre-warm blanket and cover the head? Your 5 seconds starts now. Time's up. What is the answer? It is letter D. Wrap the infant in a pre-warm blanket and cover the head. Why? The first priority beside maintaining a newborn's patent airway is what? Body temperature. Because they are high risk on dehydration because of exposure to the external environment. After delivering the baby, sa external environment ng baby, nag-a-adjust na yan sila agad. So, you need to prevent dehydration. Wrap the infant pre-warm blanket and cover what? The head, because the head is the biggest part of the baby and that could actually put the baby at risk for dehydration. Board exam type of question number 13. A 2-year-old client is admitted to the hospital with severe eczema, lesions on the scalp, face, neck, and arms. Concept na eczema. The client is scratching the affected areas. What would be the best nursing intervention to prevent the client from scratching the affected area? Tanong, meron kang 2-year-old client na may severe eczema. Ano sabi ko? Eczema? Eczema. Sorry. Anong gagawin mo para ma-avoid yung pagkakamot niya doon sa mga areas ng katawan niya na sa scalp, sa face, and neck, yung affected areas? Is it A, elbow restraints to the arms? Yun agad, grabe siya, dahas. Is it B, mittens to the hands? Is it C, hinge restraints to the hands? Or D, a posy jacket to the torso? Your 5 seconds starts now. Time's up. What is your answer, nurses? Letter B. mittens to the hands. Remember, 2-year-old, you guys. The purpose of restraints for this child is to keep the child from scratching the affected areas. I think you guys know that. Mittens restrain would prevent scratching while allowing the most movement permissible. Period. Board exam type of question number 14. Last two na tayo. The parents of the hospitalized client asked the nurse how their baby might have gotten pyloric stenosis. The appropriate nursing response would be, so paano nga ba nakakuha? Yun ang tanong, paano nakukuha ng isang bata yung pyloric stenosis? That is the question. Is it A, there is no way to determine this pre-operatively? Is it B, their baby was born with this condition? Or C, their baby developed this condition during the first few weeks of life? Is it D, their baby acquired it due to a formula allergy? Your 5 seconds starts now. Time is up, nurses. What is your answer? Very good. Letter C. Their baby developed this condition during the first few weeks of life. Why? Pyloric stenosis is not a congenital anatomical defect, but the precise etiology is unknown. Unknown etiology nga po. It develops during the first few weeks of life. Alright, so bago ko i-reveal yung final question natin, gusto lang kitang pasalamatan kung nakaabot ka hanggang sa dulo ng video na to. Maraming salamat. At dahil nakaabot ka, mag-subscribe ka na kasi alam ko naman na sa susunod na linggo, mag-upload ulit tayo at marami ka talaga matututunan dito. Okay, love you. Board exam type of question number 15. Last question for this video, make this one count. A male client comes to the clinic for checkup. In doing a physical assessment, the nurse should report to the physician the most common symptom of gonorrhea, which is, tinatanong ka, ano ang most common symptom ng gonorrhea? That is just the question. Make it simple for you to understand. Don't make it complicated, okay? Is it A, pruritus? Is it B, pus in the urine? Is it C, WBC in the urine? Or D, dysuria? Your 5 seconds starts now. Time's up, you guys. What is the answer? Yes, letter B, pus in the urine. Pus is usually the first symptom because the bacteria reproduce in the bladder. Period. Ayan, dyan na nga natatapos. Thank you so much, you guys. Please like, share, and subscribe to my channel for my nursing educational videos. Let me know about how are you feeling about this video. Let me know your scores, your comments, put it down below. Also, let me know if you have other nursing topics that you want us to do. Comment it down below. Put it there. Abangan nyo nga po yung next video upload natin next week. At gusto ko lang magpasalamat. It has been what? I think 11 or 12 days since the last time I posted. I was so busy, but you guys actually helped me to keep on going. You motivated me, and I love you guys so much. Maraming salamat po sa pagsuporta nyo sa akin at sa patuloy na pagtitiwala. Tulungan nyo na nga po ko, ipamalitan nyo na sa Radyong Sira, ang pinakabago, pinaka-fresh at ang pinaka-libreng nursing review center sa balat ng YouTube. And I'll see you again next week. Have a good one.
Thank you so much, you guys, for watching. Hope you learned something, help me grow my channel. You are already here, you might as well subscribe. Hashtag Team Kulta. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists I created for you. I'll be putting the links on the description box, so simply click this icon button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Gave except for my TikTok account, which is Neil Gave Official. I would also like to invite you to please like, share, and follow my Facebook page. The link will be on the description box, or simply search Neil Gave. And I'll see you guys next week. Have a good one.